When Loveth Metaboba's baby had diarrhea, she had a video chat with a doctor near her home in Abuja, Nigeria. One effect of the pandemic is that it has radically and quickly changed how healthcare providers care for their patients in rich and poor countries alike. Telemedicine is even being used in 2 remote Himalayan areas of India.
Most of the time of the year, these are cut off from the rest of the world because of the heavy snowfall.
With telemedicine, patients can connect with specialists in outpatient departments or OPDs and even emergency departments at hospitals in major cities.
We have been able to cater to about 3,000 consultations in OPD consultations, and more than 60 tele-emergencies have been stabilized at these 2 locations.
In the U.S., telemedicine appointments reduced the risk of further illness for some children by 99%, according to a study by the University of Texas Health Science Center at Houston. The study showed that telemedicine prevented at-risk children from being exposed to COVID-19 and other viruses they might encounter outside their homes. In rural parts of the U.S., people with opioid addictions are often underserved. There are not enough clinics or treatment centers. A University of Maryland study shows telemedicine was as effective as meeting in person at a treatment clinic. Telemedicine has also provided clinicians with insight they didn't have before the pandemic, especially in treating U.S. troops with mental health issues.
One of the benefits I think we've learned and the pandemic has really reinforced is that virtual care or telehealth is an excellent way to engage individuals. And from a rehabilitation perspective, it's so important for providers to be able to see how someone functions in their home or in their community rather than in the clinic or in the hospital.
Additionally, telemedicine has proven to get more men to see a doctor. A survey by Cleveland Clinic showed that men are more comfortable with virtual visits than with face-to-face appointments.
Many of the issues that men develop with age are intimate in nature and might pertain to sexual or urinary dysfunction. So I think that the virtual visit allows them to feel like it's a little bit more of a private conversation.
Virtual visits can stop serious conditions from becoming deadly.
Erectile dysfunction can actually be the first sign of cardiovascular disease. Urinary issues can sometimes be the first sign of diabetes or sleep apnea. So even some of these men's health issues that may be more quality of life related, get them checked out. We can often help you get back to normal function and also make sure that there's not anything more serious going on.
With telemedicine, patients don't have to take as much time off work. It reduces or eliminates the cost of travel, which can be expensive, especially in developing countries where people often travel long distances to a clinic or hospital. Telemedicine helps people see doctors they might not normally have had access to. And finally, telemedicine could improve health worldwide and reduce poverty by saving time and reducing medical costs. Carol Pearson, VOA News, Washington.